Head injuries. Few facts. A head injury is any trauma resulting in injury to the scalp, skull, or brain. A head injury is particularly dangerous as at first the injury may appear only minor, however, major internal injuries have occurred. A victim with a suspected head injury should be monitored for a number of days after the incident. Causes: car accidents, pedestrian and bicycling accidents, slips, trips and falls, being hit by a blunt or falling object, assault and battery, domestic violence and child abuse. There are 6 main types of head injuries: lacerations, concussions, contusion, hemorrhage, compression, skull fracture. Lacerations. A laceration is a tear in the skin as a result of an injury. In the case of visible bones or tendons or excessive bleeding or pain, the casualty should be seen by a doctor. Signs of laceration: bleeding, pain, numbness, swelling of injured part or skin, treating the lacerations. Assess the casualty. If symptoms appear serious, an ambulance should be called immediately. Place a dry, sterile dressing onto wound and apply direct pressure. If skull fracture is suspected, minimize pressure. If injuries has resulted in an attached flap of skin, that is avulsion, using clean water, gently flush the area. Fold the flap back over laceration and apply dressing with pressure. Use a roller gauze to secure dressing to the head. Do not remove dressings. Casualty should be monitored for the next couple of days. What is a concussion? A concussion is a temporary change in the way the brain works. When it is suddenly moved or zagged, it occurs when the brain suddenly shifts inside the skull and knocks against the skull bony surface. Concussion can last from a few moments to an unconscious state for over 3 minutes. Signs of concussion: amnesia, short-term memory loss, nausea, vomiting, headache, blurred vision, confusion, ringing in ears, neck pain, dizziness, unconsciousness, irritability, convulsions. Treating a concussion: assess the casualty, determine the severity or grade of the concussion. Grade 1, conscious, symptoms last under 15 minutes. Grade 2, conscious, symptoms last over 15 minutes. Grade 3, unconscious. Go through the table for comparison of grade 1, grade 2 and grade 3 management of concussion. Cerebral contusion. A contusion is a bruise to the brain tissue which occurs when a number of small blood vessels leak into brain tissue. Contusion occurs when brain strikes a ridge in the skull, when the head moves suddenly or hits a solid object with great force. Signs of contusion: severe headache, dizziness, nausea and vomiting, dilated pupil, weakness of limbs, restless, irritable, memory loss, confusion, drowsiness, unconsciousness. Treating a contusion: assess the casualty, seek medical assistance if symptoms indicate severe head trauma, call ambulance immediately, monitor casualties' level of consciousness. Encourage the casualty to stay awake and talk. Reassure them. If casualty falls unconscious and breathing ceases, commence CPR until further help arrives. Hemorrhage. A brain or subarachnoid hemorrhage occurs when blood leaks out of the blood vessels and onto the surface of brain. The blood then damages the brain tissue, which, along with blood loss, can cause serious and potentially life-threatening brain damage. Signs of hemorrhage: sudden and severe headache, nausea and vomiting, unconsciousness, seizure, paralysis. Treating a hemorrhage: assess the casualty, call an ambulance immediately, monitor the level of consciousness. If casualty falls unconscious and stops breathing, commence CPR and continue until further help arrives. If casualty has a seizure, clear them of any dangers and position them on the ground in a comfortable position and wait for seizure to end. Once ended, roll casualty into recovery position. Monitor vital signs until ambulance arrives. Cerebral compression. A cerebral compression involves a buildup of pressure on the brain and can be life-threatening, most often requiring surgery. Cerebral compression occurs when there is accumulation of blood within skull or injured brain tissue swells. Signs of cerebral compression: recent head injury, headache, noisy, slow breathing, slow pulse, unequal pupil size, weakness of paralysis down one side of body, high temperature, drowsiness, change in behavior, disorientation, unconsciousness. Treating a cerebral compression: assess the casualty, call for an ambulance. If conscious, rest casualty in comfortable position. Reassure them and monitor vital signs until help arrives. If unconscious and not breathing, commence CPR and continue until help arrives. If breathing, ensure airway is open. Skull fracture. A skull fracture occurs after a head injury and can be life-threatening, as the fractured bone may cause damage to the brain. Signs of skull fracture: wound or bruise on head, depression on scalp, altered level of response, distortion of face, blood in the eye, clear fluid discharge from nose or ear, bruising around eyes, bruising or swelling behind an ear. Treating a skull fracture: assess the casualty, call an ambulance. If conscious, allow casualty to lie down, stabilize head and neck, control any bleeding by applying dressing with pressure. In case of discharge, cover ear but do not plug. Monitor vital signs. If unconscious and not breathing, commence CPR and continue until further help arrives. If breathing, ensure airway remains open. Monitor vital signs. Do's and don'ts. Do's: in case of external bleeding, use pressure bandage. Head to be tilted to one side to avoid aspiration. Continually monitor the airway and victim's neurological status till medical help arrives. Don'ts: do not pull out an impacted foreign body at the site of the event. In case of internal bleeding or cerebrospinal fluid leak, do not try to stop. Wash a head wound that is deep or bleeding a lot. Move the person unless absolutely necessary. Shake the person if he or she seems dazed. Also, do not remove a helmet if you suspect a serious head injury. Pick up a fallen child with any signs of head injury. Drink alcohol within 48 hours of a serious head injury. Frequently asked questions: what is a traumatic brain injury or TBI? TBI, also called acquired brain injury or simply head injury, occurs when a sudden trauma causes damage to the brain. The damage can be focal, that is confined to one area of the brain, or diffused, involving more than one area of the brain. TBI can result from a closed head injury or a penetrating head injury. A closed injury occurs when the head suddenly and violently hits an object, but object does not break through the skull. A penetrating injury occurs when an object pierces the skull and enters brain tissue. Why is swelling in the brain so damaging? Swelling of the brain or cerebral edema is an accumulation of excessive fluid in the substance of brain. The brain is especially susceptible to injury from edema because it is located within a confined space and cannot expand. Diffused cerebral edema may develop soon after head injury.